Let's talk to Dr. Dean Eggett, GP in Doncaster and CEO of the Doncaster Local Medical Committee. Dr. Dean, very good morning to you.
Good morning, Mike.
I imagine there's nothing, good to talk to you, I imagine there's nothing in this report, I don't know how much of it you've been able to read up to now, that would surprise you. There's certainly not much in there that surprises me.
Yeah, it's 160 pages long, and you've just given a brilliant summary. I've been on this programme a couple of times talking about the problems in the NHS. You've just done my job for me. You've talked about the fact that people are living longer, people are sicker, medicine itself is far more complex, and we have a huge workforce, but we have a productivity problem. So we haven't been able to keep up with the problems of the nation. And this is what that document says. So as far as I'm concerned, it's actually good news day today, because finally we've admitted that the NHS isn't capable of delivering what it's supposed to deliver.
Yeah. One of the things that we think Wes Streeting is going to concentrate on, from what we can gather from the report, is basically that he wants to more localise, if you like, treatment for patients, so that it's less about hospitals, less about sort of central hubs, if you like, and more about the local community. What do you make of that? And if he's going to do that, where would he start?
I'm inclined to agree with Wes's statement that actually things do need to move out into the community, away from hospitals, because the problem is hospitals are about secondary prevention, secondary care. So when something has gone wrong, it's then repairing somebody rather than keeping them healthy in the first place. Primary care, the community, is about making sure that people stay healthy and don't deteriorate, because actually when people are really unwell, that's where the costs, that's where the time is spent, and actually that's where people's lives then deteriorate. Wouldn't you rather stay at home healthier and happier at a cheaper cost rather than in hospital deteriorating at a more expensive cost?
But we also know, Dean, don't we, that a lot of people deteriorate sitting at home because they can't actually see the doctor that they've been asked to see. You know, they might have been able to get an appointment with a GP, but say you've referred them to somebody else, and sometimes that wait is too long. So there's a secondary waiting list, in a way, for a referral, sometimes for weeks and weeks and weeks, or for an operation. I mean, I personally know people, as I'm sure you do, who've been told, oh yeah, we can do the hernia operation, we can do it in February of next year. You know, meanwhile, something terrible could happen to them.
You're absolutely right, and actually this report does address that in stating that we don't have the workforce in the community to allow rapid access to general practice, where if we saw the patient earlier, we might have not necessarily solved the problem, but bought time and kept somebody healthier in the community, so that whilst they're waiting for secondary care, they're waiting healthier rather than waiting less healthy. So investment in primary care to keep people healthy is really the focus of this report, which I welcome.
Right. And so how exactly would you see that being sort of rolled out, if you like, if you'll pardon the management speak? You know, would you be going back to cottage hospital systems? Would you be going back to, you know, walk-in places where it's not necessarily a GP surgery, but it's somewhere where people can go in their local community to be seen by a medical specialist?
I think probably a bit of both. Where I would start with this really is looking at the report itself, because the report is useful in that it tells us what we already know, but gives us some detail. And actually then it's almost a bullet point plan of what we need to solve. So if I was the head of NHS England trying to solve this, I'd sit down with my team and say, let's look at this report, let's prioritise on which is the most important and which is least important. Let's talk about topics that merge together and have the same problems and same outcomes. And let's look at those and say, this is the problem, how do we design the solution? So instead of saying, OK, let's do cottage hospitals because they worked in the past, maybe that's not the solution. What we need to look at is what's the problem, and therefore what needs to be the solution for that. You know, I would envisage that will involve taking some care away from big hospitals and having smaller cottage hospitals. I do think it will be more bigger general practices and actually bringing general practices together so that they work in hubs and spokes, so that bigger centres and smaller centres around. It's generally taking care away from hospitals and putting it closer to the patient in the community, I think, is probably going to be the outcome of this.
There's also talk in a couple of the papers that I've read this morning that Wes Streeting is talking about possibly phasing out the independent contractor status of GPs. You're an expert in that, obviously. What would that mean if it was phased out, and how could it be done differently?
So the independent contractor status of GPs basically means we're self-employed. So if things go wrong, it's our fault, rather than being NHS employees where actually we can take a sick day and it doesn't matter, we still get paid. So personally, I think it's a big mistake if Wes Streeting does go down that route. And again, this report states that. It talks about the productivity of hospitals being poor, whereas general practice is the only sector in the NHS where we have a bottom line that we must fulfil or we go bankrupt. So I think Wes Streeting might talk about more salaried doctors, but he will pull back from taking away the independent contractor model. What he might do, though, is open up more possibilities for GPs to be employed across other parts of the health system. So we have a deluge of GPs coming through who don't have the ability to be partners. So what are you going to do with them? You're going to give them opportunities to be employed elsewhere, and that might be in hospitals, it might be in workplaces, it might be in local councils. And again, reading between the lines, I think that's probably what's going to come.
And one of the other problems I hear an awful lot about is the numbers of people who are off sort of long-term sick from the NHS. You know, never mind the people who are off long-term sick from work in general, but the culture at the NHS, shall we say, is not one of efficiency. So, you know, people can be off sick for a very, very long time and nobody really seems to bother too much about trying to get them back to work.
I don't think people don't bother about getting them back to work. I think the NHS is broken. And again, this report says the NHS...
Yeah, but isn't this part of the reason why it's broken? Because the numbers of people who are supposed to be working in it, there's quite a lot of them not working in it.
Well, it's a symptom. The fact that people are taking prolonged periods of time out of work is because it's a toxic workplace where you're unable to complete the tasks that's been asked of you. And again, this report says since 2015, that's exactly been the problem. The NHS has been unable to deliver its promise to the population. So it's unsurprising then that people are calling in sick saying, I can't do this anymore. And what's then happening, though, is that when you get one person called in sick, it makes the job harder for everyone else. So then other people say, I'm going to give up too. And it's now become this chain reaction of people moving away from the NHS, being off sick. And yes, that does need to be tackled by looking at how to improve the workplace environment in the NHS.
Yeah. And surely they've got to move more away as well from this ridiculous sort of nursing agency system that they've got, where they're paying crazy amounts of money per day to hire in nurses from agencies because they don't have enough nurses. I mean, if they want to improve cottage hospitals or whatever it is in the community, where are they going to find the people to do that?
You're absolutely right. And the same would be said for doctors too. So we use a lot of locum staff in the NHS. Locum staff tend to cost more. They don't necessarily tend to have the same work ethic as a salaried individual or a partnered individual because it's not necessarily their workplace. They don't, you know, at the end of the day, they work their shift and they go home, which is right for them, but not necessarily right for the institution. So, you know, my analogy for the NHS, thinking about this report and the way the NHS works, you know, the NHS right now is a good old-fashioned 1980s Ford Cortina, or, you know, a Ford Escort or something like that. It was brilliant at the time. It was wonderful. It was state-of-the-art. But you wouldn't own one now because it's breaking down. It's going to suck resources and it doesn't keep up with efficiency. That's the NHS right now.
Yeah. Also, you only had 4 people getting into it back then. Now there's a queue of about 50 trying to get into a Ford Escort because there's a lot more people in the country, and that's a massive issue as well, isn't it?
It absolutely is. You know, we do have capacity problems because the population is rising, but the NHS capacity hasn't risen. And again, this report particularly points out that the capacity hasn't risen in general practice. So whilst we have pumped more and more and more money into hospitals to create capacity there, we haven't done the same in general practice. So again, what we've done is tried to treat sick people rather than keep people well. That fundamentally is what needs to change.
OK. Dean, good to talk to you. Dr Dean Eggett, GP in Doncaster, CEO of Doncaster Local Medical Committee, with his view on what Wes Streeting needs to do. They want to make it more local. They want to make it more accessible, all of which is probably a good idea. But how are they going to do it? They haven't got enough people at the moment to fill the jobs that they want. They've got 17% more people working there than there were a couple of years ago, and yet they're sort of going backwards in terms of reforms and in terms of efficiency.